This guide helps you master gastrointestinal drugs by breaking them into small, manageable pieces. You'll learn the most common GI medications with a focus on high-yield facts for Nclex and safe nursing practice. We'll walk through 4 areas: drugs for the upper digestive system, drugs for the bowels, antiemetics, and drugs for nutritional disorders. Expect clear explanations, simple mnemonics, and key nursing points that build confidence. Take a deep breath. Let's conquer GI pharmacology together. Upper GI problems like acid reflux and stomach ulcers happen when there's too much acid. Acid irritates the stomach and the esophagus, causing pain, burning, and discomfort. Drugs either reduce acid production or neutralize existing acid to relieve symptoms and allow healing. Here's where PPIs, H2 blockers, and antacids work. Proton pump inhibitors strongly block acid production by stopping the final step. Examples include omeprazole and pantoprazole. Long-term use can increase fracture risk, hip, wrist, spine, and a serious infection called C. difficile. Teach patients to take PPIs 30 to 60 minutes before breakfast and increase calcium and vitamin D. Mnemonic P for PPI and pantoprazole. Think a purple pill that prevents problems. H2 blockers decrease acid by blocking H2 receptors and are less potent than PPIs. Famotidine and cimetidine are common. Cimetidine has many interactions. Give with or without food. Monitor older adults for confusion. Remember H2, often twice daily, second to PPIs, and tidine, take before you dine. Antacids provide quick short-term relief from heartburn and indigestion. They are alkaline bases that neutralize existing stomach acid. Examples include calcium carbonate and magnesium hydroxide. Calcium or aluminum products can cause constipation. Magnesium can cause diarrhea. Do not give antacids with other meds. Space by 1 to 2 hours. Mnemonic. Antacids are for antiacid action, not with meds. After nice things, you might need one. Bowel problems usually involve constipation or diarrhea. Constipation is difficult, infrequent, hard-to-pass stools, often from low fiber, low fluids, or meds. Diarrhea is frequent, loose, watery stools caused by infections, food intolerances, or other conditions. Laxatives promote evacuation. Add bulk, draw water in, or stimulate intestinal movement. Examples: docusate sodium, a softener, bisacodyl, a stimulant. Side effects include cramping and diarrhea. Overuse risks, dependence. Encourage fluids, fiber activity. Assess usual bowel pattern first. Antidiarrheals decrease stool frequency and liquidity by slowing peristalsis. Loperamide, diphenoxylate, atropine. Watch for constipation, drowsiness, dry mouth. High doses risk misuse. Do not give if diarrhea is from C. difficile. Monitor for dehydration, dry skin, dark urine, dizziness. Remember, loperamide makes bowels go low and slow. Sulfasalazine treats inflammatory bowel disease by reducing colon inflammation. Side effects include nausea, headache, and potential kidney or liver issues. It may turn skin and urine yellow-orange. Teach that this is normal and harmless. Encourage plenty of fluids to protect the kidneys. Mnemonic. Sulfa. Stop swelling, stains skin and urine. Up next, real-world scenarios to connect knowledge to nursing all kinds of nursing actions. Antacids, some base separate by the 1 to 2 hours. Laxatives, fluids, fiber activity. Antidiarrheals, not for infections. Sulfasalazine, teach discoloration. Let's stop sickness in its tracks with antiemetics. Nausea and vomiting can cause dehydration and electrolyte imbalances from many causes like motion sickness, chemo, surgery, or a stomach virus. Antiemetics block signals in the brain and gut that trigger the vomiting reflex, improving comfort and preventing complications. Serotonin antagonists are very effective, especially for chemo and post-op nausea. Examples: ondansetron, granisetron. Side effects: headache, constipation, and risk of QT prolongation. Monitor heart rhythm with an ECG and give before nausea-inducing events like chemotherapy. Mnemonic. Ondansetron. Keep a cetron on the ECG. Anticholinergics prevent motion sickness by blocking acetylcholine from the inner ear to the brain. Scopolamine. Often a patch. Side effects: drowsiness, dry mouth, blurred vision, urinary retention. Apply several hours before travel. Advise against driving due to drowsiness. Classic anticholinergic effects: can't see, can't pee, can't spit, constipation. Corticosteroids can reduce inflammation and boost antiemetic regimens, especially in cancer care. Examples: dexamethasone, methylprednisolone. Short-term effects: insomnia, agitation, increased appetite. Monitor blood sugar and mood or sleep changes. Nutritional drugs include vitamins, minerals, and supplements critical for bones, energy, and immunity. Vitamin D supports bone health, B12 supports nerves and red blood cells. Fat-soluble A, D, E, K can accumulate. B and C are water-soluble. D deficiency weakens bones. K deficiency causes easy bruising. Too much D can raise calcium, causing nausea and kidney stones. Iron treats anemia. Potassium supports muscles and nerves. Excess iron is an emergency. High potassium can be life-threatening. Give liquid iron with a straw. Expect dark stools and constipation. Avoid milk. Vitamin C improves absorption. Orlistat blocks fat absorption and can cause oily spotting, worse with high-fat meals. Use a low-fat diet and take A, D, E, K 2 hours apart. Scenario: a patient says they'll take omeprazole when heartburn acts up. Teach: take daily 30 minutes before breakfast to prevent acid and heal. Before giving Docusate, assess bowel sounds. Do not give if obstruction is suspected. With long QT history, question the order and arrange ECG monitoring. Avoid milk near iron. Water or orange juice is best. Quick recall: PPIP, purple pill, H2s and Tidine and Dine. Antacid separate. LAX out. LA pyramide and LA slow sulfur stops swelling stains. Must remember PPI's fracture risk. Antacids space 1-2 hours on Dancetron. Monitor QT, iron straw and no milk.